Tell me where you get the stem cells from that you use in these procedures.
The umbilical cord's cut, baby's taken away, and then some short time thereafter, mother delivers the afterbirth, which includes the placenta and the umbilical cord and the amnion, and all of that tissue is rich in cells, and these cells are basically biologic garbage, and they're thrown away. So what we do is we take that tissue. You've reset the clock. These are day zero cells from a baby that was just born. They have a high degree of ability to reproduce and to secrete the three major things that we know that they do in the body. They secrete a batch of molecules that stimulate regeneration, that decrease inflammation, and modulate the immune system. So their main job in the body is to maintain the status quo. So when you're sick, you're not maintaining the cells, treat so many conditions. And the simple answer to that is the root cause of most of those conditions is lack of stem cells. Either lack of stem cells or the ones you have left aren't working properly. So if the common cause is that, then it would make sense that the treatment of choice would be replacement of those stem cells with ones that are healthy.
Every organ has MSCs in it. If you have a tooth taken out, you can take MSCs from that. But the problem with those MSCs is that they're as old as you are. And a lot of our patients are advanced age. Not only just the age, but they're dysfunctional. Like if you have an autoimmune disease, in lupus has demonstrated that your MSCs are messed up, they're dysfunctional, they don't operate properly. With MS, multiple sclerosis, we know that your MSCs do not function well. With rheumatoid arthritis, we know the MSCs do not function well. So we use day zero cells or from umbilical cord. So after a live, healthy birth of a cesarean section, then we take, the baby's delivered, the umbilical cord's cut, and that umbilical cord comes to our laboratory, and we isolate the MSCs from that umbilical cord tissue, and then we grow them up. And we don't use all of them because not all umbilical cords are the same, not all MSCs are the same. So we have a screening methodology that gets, if you're making a basketball team, it's basically the LeBron James of those cells, and we have molecular screening that we can do that tells us whether these cells are good or not, and then we'll use maybe 2 or 3 out of 100, and then we use those to grow up large numbers that can be used to treat thousands of patients.
Movie star Mel Gibson is a regular visitor to the Stem Cell Institute. He has treatments for a shoulder injury, and he's become an advocate of stem cell therapy. Mel's father, Hut Gibson, had his life transformed by going to Panama. His treatment pulled him back from the edge of death, aged 92.
Well, he was pretty old. And Brad, who was the doctor at Mayo, and we spoke to them for an hour. And it was interesting because he asked them questions I never would have thought of. I mean, what is a mesenchymal cytokine? Out of sight, out of kind. I don't know from nothing. So he's talking, and then I asked him to translate all this, and he translates it in a pretty good way. And he says, "Look at your dad. What do you got to lose?" So I put him on a plane and got him down here. And we shot him in the hip. And they thought they had to do 2 hips. But every ailment that this man had kind of righted itself, and pretty quickly too. And he started walking without pain, and he became back to his lucidity, and his kidneys were okay, and his heart and his lungs, and his eyesight got better, and he even started getting little pigments in his hair and stuff. It was insane.